My name's Niels Harden. I'm an emergency medicine physician and I work as an ER doc in Spokane Valley, Washington, at Spokane Valley Hospital. Pleasant surprises to Spokane Valley Emergency Department was honestly working with Wayne Tilson, the medical director, and it's a common theme that you'll hear this. I can kind of speak on behalf of most there, that he's just a different style of leadership that promotes excellence, not from an authoritative kind of big brother approach, but just from we're working together and how can we make this place better. It's a place committed to excellent patient care, and having trained in Mayo Clinic, I mean, it's a place where that's what it all centers around. Like, the chief interest of the patient is the only interest to be considered. That's their mantra, and we're going to continue that at the Valley. And I've been honored with the opportunity to help with some leadership there, and that's really that is my biggest passion. And it goes all the way up to the chief medical officer, the CEO even. They're all like-minded to push that forward and move it, and they're doing it. We're pulling in now subspecialists that embody that as well. And so it's a place where, calling physicians at 2 a.m. that just hate their job, that don't want to come in, that don't want to work. That happens, but we don't see it at Valley. I think a physician that's a good fit at Spokane Valley Emergency Department is someone that sees their job within a greater scope of really humanity. We're not just doing this to make money. We're not just doing it to clock in and clock out, but it's a place to serve and to really keep that interest of the patient above all things. You'll learn more in your first year being out than you probably did in 3 or 4 years of residence. I mean, it's a steep curve. So you want to be a place where that can nurture that and not be hostile to your practice style or the development thereof, or to just you in any fashion. You need to be, as weird as it sounds, but nurtured, because there's really a lot of aches and pains in that growth, but it's exciting and it's fun. And this is a place that can do that. It's already doing that, and it's done that for me. It's pretty hard to really truly evaluate a place remotely, and certainly come out of residency, as you've probably learned with recruiting. I mean, we don't learn contract stuff. You don't really. 50% of EM graduates leave their first job in their first 2 years. So, I mean, it's sort of a flip of a coin, but this is a place where we're not seeing that. We're actually seeing people coming as a first job or one of their first, and they're staying, and other people coming there kind of leaving their first job. I mean, it's just a place that's really, people like to work.